Okay, so we've got two speakers now, kind of sharing this next space. We've got Tiffany and Rowan from Western Kids Health. Tiffany is an occupational therapist, and she's worked for many years in Perth in paediatric private practice and inpatient mental health. She has expertise in supporting children and young people with emotional regulation, distress, anxiety, and assisting them getting back into doing the things they love, whether getting involved in school or sport or socialising and re-engaging with friends. She works with lots of children with different developmental disorders and disabilities. And Rowan is a physiotherapist working at Western Kids Health, and he has an interest and passion for working with children with developmental, musculoskeletal and rheumatological conditions. So I'd like to... Rowan's first? Okay, coming up, Rowan. I had these two here, I wasn't sure. Oh yeah? If you were sharing. Let's give it a look.
All right, thank you very much. Thanks, Brett. So yeah, as Brett mentioned, my name's Rowan, and I'm here with Tiffany Edwards, a colleague of mine at Western Kids Health, from Western Kids Health. It's a pleasure to speak to everyone here today, amongst many knowledgeable professionals, which is really awesome to see coming together. And so I'm a physiotherapist working at Western Kids Health. Western Kids Health is a multidisciplinary team with physiotherapy, occupational therapy, speech, dietetics and psychology under the same roof, which we're quite lucky to have that the team together. And yeah, I have a special interest in paediatric, specifically pain and fatigue in complex and rare conditions, many that feature hypermobility and gross motor difficulties as well. From this, I've developed an appreciation for the families and children with Noonan syndrome and other conditions that face difficulties day to day. Today, what I'd like to present is some information or principles of physio management on how to put some things in place for kids with Noonan syndrome to support them. And the other part of this, as I suppose a little bit of a caveat, is that Noonan syndrome, as you know, there's a big spectrum of what people present with. So they may require physio or may not require physio. And when I'm talking about some of the things today, it may be relevant for your child or a child that you know. But some of the things may be important to ask or check with your specialist or physiotherapist what kind of special considerations might be at play, whether they need to, if there's any certain morphology or risks associated with doing activity and physical activity. But generally what I'll be talking about is the principles. At the end, I might pause and ask for questions after both Tiff and I present. So within physiotherapy management in Noonan syndrome, I like to think of it as there's these three different domains that we work within. Number one is hypermobility, and with that is low muscle tone. And so for here you can see a picture of someone that has hypermobility within their hand, but when it is within Noonan syndrome, often it is globally, so throughout the entire body, which has its impact on function. Pain and fatigue, and then dyspraxia or motor processing, which comes along with some gross motor difficulties. And there's also a part of that involves psychology there, where there's anxiety and fear around school and participation at times, which I'll talk to, and some things that might be able to be useful. And I've got that flossing scene there because that's just a really nice thing that lots of kids try to do, but you might notice when there are those difficulties processing and matching different movements, that stands out, and you might notice that's pretty tricky. I mean, I find it tricky to do. Now, the role of physio, what we do within these domains is, for hypermobility, is strengthening and body awareness. So when we think about hypermobile joints, they have more movement than the average person, so they might be able to hyperextend their elbows or knees, and then also may find body awareness difficult. So being able to structure or put their body in a position and then do a task in that position as well. With pain and fatigue, we like to think about it as managing booms and busts. So booms are when they do a lot of activity, and the bust is later on in the evening when they get home and what that looks like, which is really crashing out. And then management for dyspraxia or motor processing is breaking things down, and I'll talk about some methods that physio and other allied health use to manage that, and also things that you might be able to use at home. So what does strengthening and avoiding boom and bust look like for a person with Noonan syndrome or a family? When we think about hypermobile joints, I might have just go quickly, 1 second. That's okay. So for hypermobile joints, strengthening is being the main focus. And this looks like something different across the ages. So for infants and children, it's all play-based facilitation, and moving might be animal walks you've seen at school they do, or climbing. And then as they get older and moving into the teenage ages, it may be exploring an exercise program, and really working about some structure and building up strength. Now, when it comes to hypermobility and that movement or controlling through play, what we like to think about is slowing down movements. So some different things, like an example of doing that, you might notice when your child's participating in running around, they go a million miles a moment and then fall over. And that's using momentum to get from A to B and do the things they want to do. So we like to slow that right down. So I like to think about it as if they were balancing like a beanbag on their head to be able to do that same task and slowing it down. And you'll notice it's particularly more difficult because they can't use momentum. And these are just some strategies that we use within physio, but can be replicated at home. Secondly is the boom and bust, and you might notice after the days of lots of activity there's lots of muscle pain, and seeing a physio might be useful to understand why, or what you can modify within that, within what they're doing to manage those booms and busts throughout the days. And then I'll talk a little bit more about the gross motor skills in a moment. So when it comes to strengthening a hypermobile joint, so I'll use an elbow for example. Hyperextension of the elbow is going past this, so going a bit further. I have a little bit more, so it's a bit of an example, but it might look more exaggerated in someone that's hypermobile. We like to look at strengthening the entire range that's available. And there's some really cool studies and evidence that suggests in hypermobile children with hypermobility, that exploring and strengthening into that range is beneficial and reduces risk of injuries, as well as improving well-being, which is a really interesting thing. Often it can be feeling different about how they move and that they shouldn't straighten their legs all the way, but being able to do that and strengthen with control into that has some really good implications or good results. As I said before, checking with a physio or specialist if there are any activities that should be avoided, whether there be any upper cervical issues or things like that may be need to be minimised. When it comes to exercise prescription, I like to think about this as kind of over COVID, a lot of families chucked on YouTube or Googled exercise programs to keep their kids busy at home. And a lot of those programs or things that you might get from adult physios even is to do something 8 times 3 or 10 times 3, 10 sets of 3, 10 reps of 3, sorry. And often that isn't practical or very helpful, because it can be pushing kids with Noonan syndrome to their boom and bust points. So instead it has to be tested individually and work to the warning signs. So that might be fatigue and recognising that, and it's really hard to recognise what fatigue looks like sometimes, but those warning signs might be like they start to do things silly, or they start to fall over more, or they start to drag their feet or become really loud with their movements. So there's different things that you can just look for when you are doing or watching your children doing the activities. And then also taking breaks before the crashing out points. So if you do notice those warning signs, having the breaks before is really useful, and if that doesn't happen, I might show you, if you don't have the breaks, I'll show you what happens in a moment. And then setting up goals. So if you are looking to increase activity or physical activity, which is always quite difficult in this day and age in general with screens and whatnot, setting up an expectation of what's to come is really important. So it might be, okay, this coming term we want to go for a bike ride every Tuesday. Setting that up at the start of the term and getting a buy-in from your child. Do you want to ride to this park, which has this playground, or this park, and giving them control over things is really useful for them to know what's to come. They buy into it and are more likely to do it, and then they agree to it. And then the other thing is that they then know what's coming and they can process that information when it comes, or at least prior to it when it's happening, and then it becomes easier when they're in the moment, which might help with regulation, whether that be emotional regulation or outbursts around arguments and what you do each week. So this might look familiar, what a boom and bust looks like. Kind of like me on a Friday, but it might be every day for some children with Noonans or hypermobility as well, where at the end of the day, after doing a lot of things, and that may be physical activity, but also cognitive tasks, so school, concentrating, or even social things like going to a party, or a day like a carnival day at school. Those days where there's more volume can make things a bit more difficult, and managing those bigger days is really important because it makes sense. So if a child does crash repeatedly after an activity, their brain and body learns behaviours or responses to protect them from that, which is fear or anxiety or fatigue. So minimising these instances is really helpful, and modifying them, so it may be putting in structured breaks or teaching them body awareness around, I'm noticing you're starting to get silly, maybe start to slow down a little bit. And these responses, like boom and bust, are amplified during times when sickness or rapid growth. So you might notice that shoe sizes increase by 2 sizes in a term suddenly, and often it's feet grow first and bodies grow into their feet. So that term you might need to manage those booms and busts even more. Now I mentioned the gross motor skill side of things before. Now when we're looking at learning new skills, this again can be met with some anxiety or resistance because they are new and they're difficult. And like I said before, that avoidance can be something that's a protective mechanism for these children because they don't want to fail or they're different from their peers. So setting these things up to have some wins are really, really helpful at home before also doing it at school. So thinking about practicing these tasks at home, like throwing, catching, skipping, jumping, and getting those repetitions at home is really useful to then match it to school. So it might be asking at the start of the term, what sports are you going to do at school? And even just exposing it to them before they do it at school can be useful. Breaking a task down into little parts, so whether it be kicking a soccer ball, it would be, let's practice standing on one leg first, let's practice kicking it with the inside of your foot, let's practice now walking while doing it. So practicing little parts and then celebrating even those little mini wins can be useful to build up that confidence. Some considerations for if there's hearing or vision difficulties. One-on-one practice is really useful in this when those difficulties are present. So thinking, one-on-one with a teacher, asking maybe a teacher if it's possible, or if there's perhaps an EA available, like an assistant within the class, then going, okay, could you do it as a group and then do it one-on-one with the child afterwards, so that they get that one-on-one, they can concentrate on what they're saying and see what's going on close up, and then being able to practice it. That's especially in things like swimming lessons as well, when it's a really loud environment and it's hard to hear, plus lots of body movements, and so it's just difficult in general. And then using visual descriptions can help with dyspraxia. When we're talking about dyspraxia, it's when you ask them to do something specifically and they're not able to do it, showing them how and being quite visual with that. So for the example there is having your hands outstretched like an octopus, rather than saying, hold your hands out wide doesn't have that same visual aspect. So likening it to something that they know, or if you're trying to get them to run faster, it may be, move your legs faster like a cheetah. Using those different things that they can relate something to helps with the dyspraxia. And then lastly, the plan, do, check. You might have heard of this before from Allied Health or just in general, or it's kind of similar to write, cover, check with writing, is planning, doing and checking. So I talk about this as like baking a birthday cake. And that's probably the best birthday cake I could think of. Not everyone would agree. But we go, so when you're planning to make a birthday cake, you need the recipe. So you need all the different things that need to be able to complete the task or complete the activity. Then you get into it and do it. And while you're doing it, you're not making a cake thinking, what's the cake going to look like at the end? Well, sometimes you are. But during each part, you're saying, okay, I'm going to put the flour in, I'm going to do this. And this is a nice way to talk it through with your child, perhaps as well, to give them the framework. And then afterwards, once the cake's ready, checking how it is. How did it go? What would we do differently? With, say, kicking a football, you can use this same strategy. So it would be, what do we need to do? Well, we need to stand here, we need to step, we need to kick. When you're going through the do side of things, it's focusing on, so the prompt isn't, let's kick it through the goal, it's actually, let's drop the ball and kick the ball. Because if you're thinking about kicking it through the goals, you don't really know how to do that if you're thinking about, let's just kick a goal. So it's focusing on what's at hand, kind of like when you have the recipe and you're making the flour. And then checking how it went is really important to close that loop, because when we think about fear and anxiety, if they don't focus in on what's happened or what they can do next time, then it can be overwhelming because they don't really know what happened, and then they leave the situation entirely. So going, how did it go? Involving emotions at this time can be useful. So was it scary? Did you expect it to happen like it did? Or what could you do next time? Is also a really important question. So this can be applied to all tasks, and building up this framework for kids to know I can do this for anything in the playground is really helpful, because then they can give things a go, where they can start to go, well, this is what I want to do. How do I get there? Rather than avoiding, we can start with the planning, we can start with the doing, and then going from there. And I think using a birthday cake or some sort of thing that they understand, the planning process is really useful to then translate into other activities. Now I'm going to ask Tiffany Edwards, my colleague, to come up now, and then I'll pop up afterwards for questions. Thanks.
Hi everyone, so as Rowan said, my name's Tiffany and I also work at Western Kids Health as an occupational therapist. I too have a special interest in complex conditions, including those that have hypermobility, pain and fatigue, and I'm also quite passionate about child and adolescent mental health. So I have been fortunate enough to work with some families and children with Noonan syndrome within WA, and I can see some familiar faces here today, so it makes it a bit easier presenting. So thank you for the opportunity to speak here. The role of an occupational therapist in paediatric care is still not widely known, and for some you may already be engaged with an OT, but for others I thought this presentation can help show a little bit about what we can do to support your child and your family. So within paediatrics, our role is to help the child and teen participate in their own occupation. So we know they aren't out in the workforce yet, but they still have lots of things that they want and need to be able to do. So, you know, playing, eating, learning, doing their sport, being a friend, they're all things that are really meaningful to a child, and for ourselves as well as we get older. So my role is about understanding the occupations that are important to the child and the family, assessing their skills and then identifying the possible physical, cognitive, emotional and social issues that might be impacting on their performance at this time. From here we then create really functional goals and work together to enhance the child's independence and quality of life. So the role of OT in Noonan syndrome is about improving function, supporting their emotional well-being, supporting social development, and then also being a big part in liaison with the school and community providers to ensure that they understand how best to support the child. So some of the clinical areas, and I'm just going to go through these in a little bit of detail for each one. So fine motor delay, like Rowan said, hypermobility is quite common for Noonans, and we see it a lot in hand and finger strength and the fine motor skills. This may impact their ability with things like colouring and drawing and handwriting, and you might notice that it is a bit more on the messier side or poorly controlled, or that your child might be avoiding doing those handwriting tasks and really looking into what's going on and how we can support them with that. Daily living skills is also another one, so you might see that they're having a bit of trouble with dressing, so doing buttons and zips and shoelaces, using cutlery or even toileting and being independent with wiping and going through that process. So in terms of how we would support them, would be looking at fine motor strengthening programs, what type of assistive technology might they need. So there's lots of cool adaptive cutlery and different dressing supports out there. And then as well as, do we need to do some handwriting intervention and give them some extra tools and supports on how to help that. Gross motor delay, so OTs have a bit of a crossover with physio in this side of things, so looking at those locomotion skills of running, jumping, hopping, skipping, ball skills, and that motor planning and coordination. And yeah, I won't go into too much detail because Rowan talked about that quite thoroughly. Pain and fatigue as well. From an OT point of view, this is more around those management strategies. So how can we really give them the tools that they need at school, and giving that education to the teachers around breaks and different seating positions and calm down areas, for example. And also helping the child understand what pain and fatigue actually is, and using simple analogies and things to help them understand and how they can tell mum and dad when they are in pain or feeling really tired. Executive functioning, so we know that people with Noonan syndrome may be at heightened risk for concentration and attention difficulties, and there may also be some working memory and organisation challenges as well. So helping set up different things, whether it's morning routines and scheduling, supporting for the teachers as well to be aware of those challenges and how they can manage in the classroom. The other thing with executive functioning is being able to manage those impulses and that emotional control, which is another area that we can support with in terms of helping the child understand different emotions, managing those emotional outbursts and the calming strategies that they may need to be able to regulate. As part of the emotional regulation as well, it's helping with, you might find that they have some low self-esteem or struggling with some bullying. So we would also work in consultation with a psychologist if we felt that was also going to be supportive for your child. Social skills, so again, they may have some social skill difficulties with making friends, conversational skills, body language, tone of voice, and occupational therapists as well as speech pathologists do quite a lot of work in this area and helping the child feel really confident and resilient with their friendships, and then again managing those conflicts and bullying that may arise. Sensory processing. So for some, they may have heightened sensory responses, so the environment may be too loud, or the lights are too bright, or the clothing feels funny. So we would explore the sensory profile, which is a really quite long and thorough sensory assessment, and really work out what's happening for the individual child before then making recommendations. There are a whole heap of amazing resources and things online, but it's really trying to work out what's going to be best for your child. And then lastly is the school support, which is a big part of what I do, is going into the school and observing the child, organising meetings with the teachers and the deputies and the EAs, and giving those school recommendations on they might need extra time to finish the test or during that plan, or they might need modified teaching or to complete their assessments and things in more of a quieter area. And what equipment can we put into the school? So is it a wobble stool or a movement wobble disc? Do they need a different pencil or a slope board? What sensory tools have we found out from the profile that's really going to support them in being able to focus and engage with their peers? And then we can also have some support and advice into the IEP plans that children with additional needs get through their school. So that kind of concludes my part of the presentation. We will now open up the floor to questions for either myself or Rowan.
Thank you. So my daughter is just about to turn 9, and we've just put her training wheels back on her bike because she would not touch her bike without it. She also struggles with swings, hates swinging. So is that something that would be considered like a motor delay or a processing disorder or something, to have that movement, the fear of that movement while she's balancing or whatever?
Difficult to determine. I suppose there's a couple of things probably that may be at play for kids that find it difficult to tolerate the movement side of things. So as to whether it's overwhelming just having that, we call it vestibular input. So when you spin or jump and move, those fast movements. And so differentiating is that something that's not tolerated by her, and then what we do is kind of grade up from doing something that's low level, building up to being able to tolerate it more, or is it because of the visual input, suddenly moving the head is a lot of input, and if there's anything that's going on around that space, and then the other thing is if it can just be a very scary thing to do, and when thinking about the training wheels, it's very stable and you can only move in 2 ways, forward and backwards. So taking off the training wheels suddenly adds another plane element. So that doesn't necessarily mean there's a gross motor delay in that area. You kind of look at around that time, kids do start to learn to bike ride, or at least the pedalling part of things, and then there's other things that kind of build up to take the training wheels off. But yeah, as to if it's there's a few different things that may be going on, and then with the fear of movement, taking off the training wheels, it is again grading that up. And there are a few different bike riding programs that are delivered around Australia and in Perth, to build up towards riding a bike, and so there's some different avenues as a group, because there are lots of kids at a similar age that haven't picked it up, and they are a little bit later on it, but it doesn't mean that they can't as well.
And it doesn't matter if she doesn't, if she's 15 and rides a trike, I'm okay with that, but it was more about her fear of the movement, swinging and that kind of stuff as well.
Yeah, and that may cross over a little bit into the sensory processing side of things, if there are those things that cross over into not tolerating lots of different sensations, so that kind of into the sensory space for OT as well.
Well, thank you.
That's okay.
Just with the bike riding, where do I find those groups?
Yes, there's a couple. What I could do perhaps if I could pass it on to you, Brett, and then we can circulate a few different options. Yeah.
And also, would bike riding come with strength in the arms and the legs?
Correct, yeah. So there's a few different things. So bike riding requires strength to be able to push the pedals, hold on the arms as well, so upper limb strength. Yeah. Also, I suppose, trunk and back strength to be able to hold yourself still. So when you push with one leg, that your body doesn't fall that way.
She wanted the training wheels off, but she can't. She can't balance it. I think it's a strength thing as well for her. She can do the pedals, but I think it's the balance.
And it could be even just building up a bit of a plan for you to guide that movement. It sounds like they're really keen, which is the first thing.
Yeah, she's keen.
It might involve like Rowan's cake analogy of like, having her do some lateral movements and having her do the forward movements and then trying to put it together.
Yeah, we're trying to do that as well. We think of her as well, so with strength in her arms and her legs.
And with bike riding as well, it's kind of it's a tricky thing, because the faster you go, the easier it is to ride, because you don't have to do as many big movements. But to go fast, you need the strength and the momentum. Using gentle slopes on grass can be a bit more of a safer option, where you get that momentum faster.
Just on that.
Yes.
Sorry. The balance bit, would you be like in younger kids? They get balance bikes and they work off that, and they get onto normal bikes and they don't balance. Would you go back to a balance bike setup without the pedals?
Potentially, yes. That's a really nice option as well, because then it also, in some ways, equips them to be able to tolerate and build up the confidence to not.
Well, I've been trying to do the thing with pedals on the bike, the legs just keep hitting the pedals and stuff like that.
Yes, it can be even taking the pedals off a bike. Yeah, those are options. Yeah, that's a really, really good idea.
I was just going to say on the bike riding, I think we shouldn't really have too many expectations on our Noonan's kids, because in general they are a lot physically weaker. So they are.
It doesn't worry me if she doesn't ride a bike.
I think it's
she wants to be ride a bike.
Pretty common that our kids are going to be a little bit delayed, I think, in achieving the same standard that other kids are going to. Like Sienna's 10 now, and she only learnt to ride without the training wheels like 18 months ago.
Okay.
So, and she struggled with the balance and the pedalling, and like just literally the physical strength of pushing the pedal with one leg. It was hard for her. So I think it's just a delayed thing. But it was not really a question, it's more of a comment for other parents that don't access physio or the OT. I just wanted to say I found it so invaluable. Like, I can't explain how valuable it was for me as a parent. I think that everyone says we try not to, but we end up raising our kids like our parents raised us, and a lot of it's through habit. And when I was raised, it was always look at the end goal. So you play to win. You play a game of netball or something, you play to win. And whereas when you've got a child with special needs, it's a whole different ball game. Like, you've got to, like what Rowan says, you've got to break it down step by step, and you've got to celebrate those small wins of, managing to just throw a ball, or catch a ball, rather than play an entire game of sport. And that's not how I was raised. So it's been a very big learning curve to try and teach my child, or teach myself, to parent that different way and to celebrate those small wins and break everything down into tiny little aspects. And they're just things that you don't think of. When someone teaches you those things, it's so worth it. It's really great. And Sienna, my daughter, pretty much has everything on Tiff's little chart there. She's got the fine motor, gross motor, pain, fatigue, social skills, the sensory processing. She's got the lot. And having someone there that can help your child work through all of those is great, because you're trying to push them to be the best that they can, not better than everyone else, but the best that they can be, and do the best that they can. And when you do that, you get a lot of emotional shutdowns and things like that, because they feel like they're different to everyone else, and it's good for them to have someone that they can talk to about all of that. It's really great.
Hi, this is a question really for Rowan. Our son has sort of a combination of physical issues. So he has hypermobility in most areas of his body, but he has limited ability, limited movement. He can't straighten elbows and knees. Have you seen that in other Noonan's children? And what is likely to be the cause of that? Is it bone or muscle that's actually causing that rigidity in those areas?
I suppose, not knowing your child in particular, I can I suppose speak on what I've seen with other kids with hypermobility. I also haven't seen it necessarily in Noonan syndrome, but in children that are generally hypermobile or have hypermobility spectrum disorders or connective tissue disorders. And so I can, I suppose, generalise a little bit, but not to say that that's specifically relevant for your child, because I don't know them. Now, I suppose when thinking about hypermobile joints, it's the ligaments within the joints that are more flexible. So the ligaments are kind of like these ropes that hold the joints from going too far or past the end of range. And that can be in certain motions of movement, so like say up and down, but also other movements, so rotational movements as well, and side-to-side movements. Now, when the ligaments are more lax or have more movement, muscles can compensate really nicely in a way of building up strength and controlling that movement, but also that can go the other way where they become, they become a bit more tighter and can have restrictions. So for example, many hypermobile kids do find that their hamstrings and calves are more tight to compensate for the movement that is at the knee, and so they might find it difficult to sit down with their legs straight, like for example. So in those instances, muscles can tighten to compensate, and that's not necessarily a bad thing, depending on what it may or may not stop them from doing or enable them to do. So it's a bit of it compensates for a reason, as to what that impact is on each child can vary. And then the other thing is growth. So as children do get older, their connective tissue can stiffen. Also the long bones of the body, so thinking about the long bones of the arm and also the femur and tibia, so the leg bones, they do grow particularly faster during periods of rapid growth. And during those times, you may notice that the muscles also are shorter compared to the bones, because bones grow quickly and muscles take a little bit of time to catch up. So during those times, you may also notice that there are restrictions, but that can ease as time goes on. The main thing is that muscles stay strong throughout the growth periods to manage the pain and fatigue and enable them to do things they want to do. So there's a bit of a roundabout way of answering that question, but it can be something that's happening, and I'd probably suggest if there are restrictions to what's going on, so they're not being able to do things like ride a bike because their elbows are bent, then having someone assess that would be useful to see what out of those different things I talked about may be at play. Okay.
So I know one time when we came to see you in physio, you were talking about Sienna's posture, and sometimes with the hypermobility, it's better for her to sit in a position that's comfortable for her. Would you say the same thing about, when children sit in what they call the W position with their knees bent? Because we've always been told that's really bad for hips and knees and things like that, and bad for your posture. But is that like if it's comfortable for kids with hypermobility, or is that good or bad?
So if there's no so going back into children with issues with their hips or muscle strength difficulties that they stop them from being able to get out of that position, that's where the general recommendations around W sitting have been developed. For children that can get up and move out of that position and don't have any issues with their hips, specifically, like things like hip dysplasia or any other difficulties around their hips, it's fine for them to do. So W sitting is a different way of sitting where their hips, rather than being in an O position, they're using the internal rotation of their hips, so the other position, and there's studies that do explore that, and that there aren't any negative impacts on walking or causing them to in-toe or any other things like that. The main recommendation is that they don't stay in one position for a really long period of time, but that's like all of us. So not sitting down for longer than 40 minutes anyway. Movements are really important. There is an article, or I suppose a blog piece on Western Kids Health on W sitting, if you'd like to explore that, and it does have some really interesting pictures of the hips as they do develop. So you might notice kids W sit between 0 through to 7, and then they start to reduce W sitting because their hip shape actually changes as they grow. But for kids that are hypermobile, they maintain that flexibility in their hips, so they may continue to do so.
Thanks so much for your time today, guys.
I'll just ask, what would you recommend, probably in the ladies' what would you recommend as the best sport for a young 8-year-old to do to build up their muscles and stuff? Would that be you?
Oh. Maybe both of us, but...
Mind if I answer that? Okay. There's no particular one sport that is the best for any child. It's what they're really interested in. If they are experiencing pain and fatigue, then we do sometimes direct as a bridge towards building up to other activities. Like swimming and bike riding are really nice activities because they are lower impact, so they may be able to manage the pain and fatigue a little bit more. But longer term, if there's no recommendations from specialist or physiotherapist around contraindications for, let's say contact sports or activities that involve jumping and landing, then there's no one sport that's best. It's going to be the one that gives them an ability to run, move, get their cardiovascular system, so huffing and puffing, and having some form of social interaction too. So team sports are nice in that way. If they are finding it hard to participate in team sports because of sensory issues or because of other limitations around the social side of things, having lots of people around, then that's where you can look into other sports. Like karate is really nice because it's something that's builds control and balance, or those one-on-one sports where they can have a win individually and pace their activities. So sports like footy, really hard because the ball's flying and they've got to run and there's someone running past them, and if they've got motor difficulties that can make it tricky. Whereas those sports that are stationary, where you have time to prepare what you're doing, like karate, or golf isn't the biggest one for kids, but golf, something like those different sports are useful to bridge them into having some wins because they have time to go, okay, plan, do, check.
Thanks so much, guys. Okay, I just want to introduce our next